I understand you use IV therapy in your practice.
Yes, we use IV therapy as a nutritional therapy. We don't give any drugs through the IVs. We're giving vitamins and minerals and amino acids in combination or one after the other. And we found that to be extremely successful in helping people get rid of their addictions, and especially for the detoxification part, because a lot of addicted people are nutritionally deprived. They're not eating right. They're eating the wrong food, so they're vitamin and mineral deficient and also amino acid deficient. So if you give them these things, and intravenously is the most efficient way of doing it, you can get them better a lot faster, and you can reduce the withdrawal symptoms enormously. I had a patient last week who was using oral narcotics in pretty high dose, and he came in on a Saturday, and I saw him on Sunday, and we couldn't give the IV on Sunday. If we'd been able to do that the first day, I think we might have been able to get him off without any medications or almost none, but as it was, in about 3 days, he was completely off with very minimal withdrawal symptoms, whereas most people using narcotics will have a lot of symptoms, nausea, vomiting, diarrhea, aching, and all that kind of stuff, usually requiring a pretty good dose of medications, and he had hardly anything, with very few symptoms, so it can really make things go a lot better.
Why do you think most treatment facilities don't use this?
Doctors are not really nutritionally oriented. They frequently will tell the patients, you're wasting your money on these things, you're paying for expensive urine, and it doesn't do anything, and why don't you just eat some food? And they're not thinking about the fact that a lot of people don't eat the right food. They may be overweight, but they're overweight on chocolate bars and soft drinks. They're not overweight eating broccoli and asparagus. So they are nutritionally deprived. They don't have high quality foods, and a lot of our foods really don't contain the nutrient values that they should. And the other thing that's frequently absent is essential fatty acids, which we use routinely, not intravenously, but orally. So we supplement people by mouth and frequently intravenously. The intravenous part is mainly for the detox, for the acute withdrawal, because it is so good at ameliorating those symptoms.
Dr. Sosin, give me some examples of some of the success stories you've had in non-addiction field.
Well, we work throughout medicine. We handle almost every type of problem a person can have. So we have had successes with reversing osteoporosis without drugs. We can reverse diabetes without drugs. We can reverse hypertension without drugs. We can help people who have cardiac disease either without drugs or with minimization of the things that they're on, because a lot of people with medical problems are given not 1 or 2 drugs, but 5, 6, 7, and 8 drugs. And a lot of times those drugs are knocking them down. They're making them ill, and the patients may not even be aware of the fact that the drugs are making them sick. So we evaluate all those things. We put in nutritional therapies and other therapies, intravenous vitamins sometimes and minerals, and we work with herbs and all of those kinds of modalities that are almost entirely without problem. I mean, about the only thing that can happen to you from taking too many vitamins is diarrhea, and then you just back off on the dosage. But people do not die from nutritional supplementation. It virtually never happens, as opposed to the 100,000 people a year who die in the United States from the drugs that their doctors prescribe.
Give me a success story in one of those categories.
I have a fellow with cardiac disease. He came to me a long time ago, probably 12 or 13 years ago, with a cardiomyopathy, meaning that his heart muscle was weak. And he was given a prognosis of not being around for more than a couple of years. And we went after this, as he wanted to, with everything that we could, because he was a person of means. He could afford to do things, and he wanted to do everything that I could think of and that he could think of that might work for him. So he did detoxification, he did sauna, he took a lot of supplements, we did chelation therapy for heavy metals. We did something called external counterpulsation therapy, which is a compressive treatment of the lower extremities with expandable cuffs that forces blood up into the heart to increase circulation. We worked on getting him off a few drugs, but using those that we needed to, but not very much. And he, in the last 12 years, has gone to a situation where he basically has a normal functioning heart, with the exception of his rhythm problem, which has persisted, but he has atrial fibrillation, but he's living with it, and it's really not causing him any symptoms. And he's at the top of his game right now. He's doing some things that he's wanted to do for years that he was not able to do because he had the heart problem, and that's gone. You know, he's doing exactly what he wants to do, and he feels great, and he looks as well as I've ever seen him, and this is 12 years later.
This is great. This is where medicine should be now.
It should be. You know, you have to first understand, you know, that the drug is not the answer. The drug is something you can use to help, and sometimes it does keep a person alive. But the problem that occurs with people as they get older is that there's more and more physical problems, or more emotional problems, or some kind of stress, and the answer to that can't be to just add another drug for each problem that comes up, because then you end up with a person on a whole bunch of drugs with a lot of problems from the drugs and really no resolution of their basic medical problems. I mean, after all, taking antidepressants doesn't remove the reason for the depression. It changes the person's perception of depression, and maybe they'll say, I'm not depressed anymore. But what problem did they resolve? You know, did they handle the angry mother-in-law, or did they handle the problem with the boss, or did they handle the fact that they haven't learned how to communicate with people? You know, what did they really handle? The drugs don't help you handle anything. They don't solve problems.